All right. Aloha and good morning, everybody. Welcome to our HSMAI February education event today featuring Lieutenant Governor Josh Green. I'm Mari Kam. I'm the current HSMAI Hawaii chapter president, and I'm honored to welcome you to today's session. HSMAI is the leading global association for sales, marketing, and revenue management professionals. And we represent all segments of the hospitality industry and our partners. As many of you who join us regularly know, we host a series of monthly events focused on providing insight and expertise for the hospitality industry. Just a couple of quick housekeeping notes before we start. Lieutenant Governor Josh Green will be taking questions after his presentation today. Because everybody is muted, please feel free to drop any questions that you have into the chat, and we will be asking him those questions at the end of his presentation. Also, just so you know, today's session is being recorded, so it will be available for you to access to view after the event ends. We're working really hard to continue to provide you with quality content for free. And sponsors like our sponsor for today's event, who's Outrigger Hotels and Resorts, are sponsors who make that possible. So mahalo to Outrigger Hotels and Resorts. I'd like to just share a brief message from our sponsor. Let's see if I can get this going.
Mari, I think you need to share the screen, the computer volume again.
Yes, much more impactful if we have sound. Thank you. Let's try that one more time. Okay, and without further ado, I'd like to introduce you to our guest today, Lieutenant Governor Josh Green.
Aloha, thank you for having me. I so appreciate it. And I just, I'm all yours for the hour. I wanted to share my screen, and I will, if it's okay, to give a couple slides. Let me pull those up right now here for us. And here we go. So again, thank you for welcoming me. Just a couple quick comments that might answer a lot of our questions. And then I will just say before I dive into this that things are looking good right now. You'll hear later today that we had only 45 cases statewide. Our positivity rate dropped down to 1.19%. That our hospital numbers are now at 32, which is the lowest number we've had since long before the big surge in July, August. And that because that the numbers have been good, we're able to actually open up. And we're going to see that move forward very nicely unless we catch a very unlucky break with one of the variants, which we're mindfully watching. Finally, this hasn't been mentioned yet, but Johnson & Johnson will likely be approved tomorrow by the federal government. And that'll mean an additional 11,000 vaccines per week, at least out of the gate, probably 20,000 once we get revved up. And they're worth twice as much because there's only one shot. So we're going to get to immunity much more quickly than we thought, which will serve a lot of our needs to keep our kupuna safe, but also to restore normalcy to our lives here in Hawaii. And it's going to happen, I think, very quickly, which is going to be a blessing because it's been a really tough year. So let me dive right in. That's okay. Here we go. This first slide, you can see that over the last week, from the 14th to the 20th for February, we have the lowest infection rate per capita in the country. You can see we're there all the way on the left. We've been last on a few things over the years, which was sometimes a bummer, but this time being last as far as cases is great. We have the lowest number. So you can see we're actually even half of what the next closest state, which is Oregon, is. We have had very low infection rates, and it's a combination of many things, isolation, but also the success with wearing masks. Our vaccination program has really been going well now. We're 7th in the nation, up from 8th best to get vaccines into people. Though it seems a little bit tricky, I'll explain that more later, but it's going well. And here you can see the infection rate across the whole pandemic from March 7th of 2020 through February 20th, 2021. So it's an important milestone for us to mention that we've been best in nation, and that will be very relevant to our communications globally, which will get us there a lot better. So wanted to share that with you, lowest infection rate. And here's the mortality rate, the death rate. I speak as a physician in this case, lowest rate in the last 7 days. You can see there we are all under the rural states like North Dakota, Maine, Alaska, and so on, lowest. But even more importantly, the entirety of the pandemic, we've been the lowest now, comparably low to Vermont, which is a rural state with even half of our population, with 600,000 or so people live there, Arkansas, Maine, and so on. So it's been an extreme blessing to see us do well, but every life lost was hard. We've had 435 fatalities in Hawaii. I will tell you this, we had projected 4,479 fatalities if we didn't act. And that would have put us right smack dab in the middle where like Tennessee or Michigan or Iowa are. And that would have just been devastating. So you can see that we've done what we can to weather this crisis. This is a very basic slide, but it's important. The most important things we can do are wear masks, wash our hands a lot, and stay 6 feet apart. That's what does prevent the disease, although other things also are important, like testing. We do a lot of testing. Contact tracing is critical. We have 304 contact tracers, I believe, statewide. Isolation when people are positive. Now, if you're immune, though, from a vaccine, the CDC has told us you don't have to isolate if you come into contact with someone who's got COVID. Our health system is good. We peaked with 318 people in the hospital back on August 26th. And like I said, we're down to 32. So our hospital system, our healthcare system is intact. And we were able to get all of the modern treatments, including antibody therapies and everything, so we could keep our friends and family alive. Safe Travels program was able to open us up again safely. That was something that I was honored to engineer with a couple others to start us. We should have started, in my opinion, in July of last year, but the big surge on the mainland was a problem, and then we surged. So we started on October 15th, and since then we've had over 1.5 million travelers to Hawaii and over 1 million visitors. The other 400,000 people were our own families returning. And when I show you the graphs and the numbers, you'll see that we've had very little spread from people who are traveling and visiting here as vacationers, but our own people do sometimes spread it because we go back into our jobs. But we're still doing well as you compare us to the national numbers, as you saw. And then the vaccination distribution plan is something I'm going to break down for you in great detail coming up. Here's our mask numbers. 90% of our people across the state are wearing masks reliably, 98% on Big Island right now. That's why their numbers are almost zero. Maui doing better than they were, but still they've had a little bit of an uptick lately, a lot of activity on Maui with some clusters at homes. City and County of Honolulu, which just went to Tier 3, has been doing well. And Kauai hasn't had to wear masks quite with the same extreme need because, of course, there's almost no cases there. But the consequence of being closed has been significant. You know, it's very difficult for people to hang on economically. So eventually that's going to have to open up. And I don't want to get into an argument with even friends that are dear to me on Kauai and the leadership there. I just think that we're going to have to move forward as one state. Now, here are the consequences, though, of having COVID hit us, the health and housing impacts. You can see that this was a slide from a couple of days ago. The most updated numbers are even more severe. We've had more than that 15% increase in Medicaid. We're now over 400,000 individuals on Medicaid, and we'll update that slide in the next couple of days. It's very, yes, absolutely. I'm happy to share this presentation with everyone. You can see my slides right now, right? Someone give me a signal there. The truth is we've had a big surge in poverty. and mental health care has been a great concern. So the mental health numbers, we've had over 40% of our people feeling lonely or despondent about the future, and that will change very quickly as we open up. But there's been some depression that we have to deal with. We thought there was going to be a surge in suicides. We haven't had that, it turns out, statistically, although sometimes we don't get our data in real time. So it takes a little time to get that. We'll see. And in my family, we've struggled with that kind of issue. So I'm very, very sensitive to what we do when we lock down. Food insecurity, over 1 in 5 of our families has been food insecure. And we have to also work on that. So special kudos to the, food bank and so on. They are just amazing. And then housing was a problem. We had over 11% of our residents couldn't afford their rent. And so that was the consequence of economic downturn. But we will come back, and our numbers will rocket upward as far as travelers go as soon as they allow my policy to go into effect, which is to have essentially the vaccine passport. If you get vaccinated plus 2 weeks, you can travel here without any hesitation, and it's safe. So that will be the policy. It's just a matter of how long it takes. Here's a comparison of after Christmas, New Year's versus now, yesterday. And we had 105 people right after the surge from Christmas and New Year's in the hospital. Now we're at 34 on average. Big drops. I mean, really super drops. Our statewide average is in new cases was 139.6 on January 5th. It's now down to 50. And our positivity rates have been plummeting. As you can see, we went from 3.48% statewide to 1.15% statewide. And also for Hawaii County, all the other numbers have just really been, dropping. The positivity rate from city and county of Honolulu at 4.48% is now almost exactly what it's at Maui. These surges are common for us to see, but that did drop significantly down to 1.06% positivity rate in Honolulu. And that's why we're able to open and decrease the restrictions. So that's good. Kauai stayed stable and dropped. Maui County actually is better than it was 6 weeks ago, but they were coming off of the other surge. And so it's been challenging. All of this, however, is a good sign that we've been able to keep the lid on, and we have not had a significant surge of variants. Not that we haven't had any, but the UK variant would cause more spread. And so we're mindful of that. So we're going to export a Hawaii strain, which is going to be a mellow, take your time kind of strain virus. It's not going to spread quickly at all based on our personality. We're hopeful. So we're going to go with the Safe Travels program until we have some other option. And that's the numbers I shared with you. It was 1.473 million people screened. 89% got the exemption from being tested or being exempt for other reasons. Pretty few people in quarantine right now, and you can see over 1 million visitors. But we would have normally had 3 million visitors in that time frame. So needless to say, it was a big change. So we're going to continue on this track. And then ultimately, when we can, you'll see the spikes in passenger count again turn up. And I'm happy to share this with any group if it will help our people in Hawaii, because some of these are economic numbers, and that's important to reflect on. Here you can see what the Safe Travels looked like. Look back right in the middle of this thing. That's when we reopened again. You did not see a spike in cases. And the blue at the bottom is the travel-related cases or our visitor cases. So it's going to really be, incumbent upon states and countries all over the place to make sure that they know that they can do this. If they have a pretest, they're fine that way. It's not a worry. But also with vaccinations, that's going to make us even safer. So we're coming down off that mountain that we had after January, and there's the blue lines. The dark blue lines are the travelers, the visitors, vacationers, but the lighter blue is when we had a surge just of our own people coming back. If you went to Vegas and were, spending and losing your money there while having a good time, you were going to catch some COVID. It's just what happened. So that was one of our issues. Here you can see our unemployment numbers, which went from nation's low to highest in the nation. We went to over 23%, and we're now dropping really well. So we'll go back down to unemployment rates under 5% before you know it. It's just the nature of Hawaii. We still have underlying other economic challenges, like people have to work too many jobs and so on, but we're really going to come out fine, especially if we can market that Hawaii was the safest place in America to travel to. We're going to see actually safe haven initiatives, I would suggest, out of my office and from my team to bring more people here so that we can, diversify a little bit. so that we don't have to worry if we have these kind of crises that we are, starving. So that's where we've been economically. Here's an economic pulse slide that came from UHERO. You can just see basically after October 15th, we did get to surge a little bit, but it's still been pretty tough times. And this is going to jump all the way back up to baseline or near baseline in September, October, November, in my opinion, as we see what the summer looks like. Most of the country is going to get vaccinated and reach herd immunity sometime in late summer, early fall at this rate, which means that won't be normal, but we will be pretty darn good. Now let's talk about vaccines. If I could only get the Department of Health to move this little thing on the 1B, I'd be happy, because we're almost done with phase 1B now. We are moving into 1C probably about the 15th of March, it looks like. As of this morning, I can tell you that we have vaccinated or given 326,766 shots. That's up 8224 from yesterday. We'll do 10 to 12,000 shots. Typically, we were coming down off of that storm, so we were being a little cautious, but the storm on the mainland. The good news is we received this week alone 76,000 doses of the vaccines. And next week should be another good week. We'll have at least 53,000 plus probably 11,000 extra shots from Johnson & Johnson. So we can now roll forward and move from the 1B to the 1C categories. And I'll break this down a little bit more. People in the traveler accommodations industry are essentially 1C overall. There are some caveats to that, especially people who are very high risk individuals, front facing, lots of tourists. Some of the businesses have been able to get, based on some of the other subcategories, into 1B. But in general, we're going to all move to 1C now, just so you know, and we're going to aggressively vaccinate. So though it's natural for us to be fixated on my 1B or my 1C, we're done with 1A. You're about to see this slide here in a second. Here's our total numbers. We're going to move directly with these kind of numbers. We're going to be able to vaccinate, well more than 60,000 people a week. We have that capacity, and that's going to make us safer and get all of our people that are out there working vaccinated. Here's some overview numbers on vaccination dosages and who's gotten both doses and so on. So almost 14% of the population now has gotten 1%. Remember, we don't think the whole population is going to want it. So we may only have a universe here of 75% of the whole population that gets the doses. That would be about 900,000 people vaccinated, which would be probably fine. We do want to get all of our kupuna vaccinated. And so when you look at these statistics, you can see that we're going to aggressively ramp it up. That's why the curve is so steep. And we will pass 350,000 vaccines by this weekend, which is to say that the end of February. We'll pass 600,000 shots given by April 1st. We'll pass 850,000 or 900,000 by May 1st. And we'll be over 1.1 million shots by June 1st. So you can see that by the time we get to summer and lots of travel, we're going to be pretty darn safe. Now let's look at this distribution. Maui, that number there lags a little bit because they had several thousand of their doses that they gave didn't get uploaded yet into the states and federal VAM system. So they're much closer to the Hawaii number. I know that that's not comforting when you see yourself on a slide if you're from one of these counties that's lower, but they also are going to deliver 8,000 doses that had been partially reserved, where now Mayor Victorino and I are pressing hard to get those shots into people right now. Everyone got a little gun shy when there was the delay on getting shots. So you can see we're pushing forward, and it's going to be great when we're 20, then 30, then 50% of the population. And that's going to happen by summer easily. Here's what 1A is. Healthcare workers were 40,000 individuals, 10,000 individuals who are kupuna living in long-term care facilities. They were critical because you can't have healthcare workers spreading the disease to other patients, and you can't have people in long-term care facilities because they're very likely to die. Their probability of death is like 8,000 times higher than baseline when they're over 85 years old. I mean, it's a giant number. So that's true of the flu. It's also true of COVID. So you had to really get individuals vaccinated. And then the 1B category, over 75 is the priority. There are 109,000 of our kupuna that live that are over 75, and frontline essential workers in the 1B category. That was like people keeping the power grid going, some government work that required to keep the state active and open, certain harbor services, and so on. But also, when you look at it economically, phases 1B and 1C are critical to, number one, keeping the casualties down, but also keeping the state alive. And that's why we stratified it this way. 1B, this was the first list of frontline essential workers. You can see first responders, medics and stuff, transportation infrastructure, emergency dispatch, corrections, utilities, teachers, because we want to get the schools open. I have a 10-year-old in public school, and it's tough. It's tough on him. We do what we can for him. Our 14-year-old, who's lucky enough to be at Iolani, they didn't miss a beat. So, there are pretty big differences. We will be opening the schools, it looks like, by the end of the third quarter. So right after spring break. I'm getting some details in the text feed right now. So we're going to get some of that going. And then here's what 1C looks like. We're going to go 70 to 74 starting about the 15th of March. And then we'll go 65 to 70 about 2 weeks later. Also, people with underlying health risks, the most pressing of them are if you're on oxygen, if you're on dialysis, or if you've got cancer. Those are the three groups that will accelerate to the top of the list, but everybody otherwise in the 1C category, all the other essential workers, which includes hospitality and traveler accommodations, and also all the other individuals that have other risks, like, severe asthma or heart disease and diabetes and so on. And this takes us to about halfway through the state, and that will happen close to the early part of May. And that's going to be exciting to see. Some additional quick considerations as I come down the home stretch of this presentation. If we have a cluster, we'll vaccinate there around the cluster. If there's extra disease spread because of socioeconomic concerns, like a lot of people living in three generations living in the same household, that kind of thing, sometimes we may vaccinate a few extra people there so there's not rapid spread. And so that will be something that we do to be safe. And then we'll get to phase 2 and phase 3, which is phase 2 is like Marie, who young, healthy, nothing can get her sick at all, no matter what you try, but you still got to get vaccinated if you believe in it. So we'll do that group. And then children will come last, which would be the group that has to get approved by the FDA. We have not approved any vaccines for underage, 16 or younger. So that's going to take a little bit of time. Probably not even that consequential because kids are not manifesting the disease very badly. These are the resources that people should know for their businesses. HawaiiCovid19.com is where we're registering people. And sometime either by the end of this week or next, we hope to have a universal vaccine registry so that it's simple, one way, one button to click. If I was running it that way, there'd be 2 buttons, travel and vaccinations. That's it. And then you just go into one or the other and you see what you need. And we'll also simplify some of the travel rules because, as you know, I'm pressing hard for, I call it Operation Vaccination Shield, which is if you're vaccinated plus 2 weeks, you can travel. And that means inter-island, it means coming to Hawaii or whatever. You will be immune. You might carry a little bit of the virus with you, but we're still going to ask people to wear masks until the fall. So it should be fine. And that's my social media handle. If people don't mind, please follow me on at LTGovJoshGreen, at LTGovJoshGreen, or put me in your cell phone. My cell is 937-0991, 937-0991. If you have a crisis, text me. But the social media thing, I will give you a 1 to 2 minute update every day. And my team and I will look at those. Unless people are really going off on me, we respond. And so that's a way for us to, communicate really quickly. But if you could get thousands and thousands of people connected to that, it's a way that I can communicate, since we know that the Gov is a little bit of, a silent type, right? So I'm happy to put some of this extra information out. And I think maybe I'll stop there to take everyone's questions, if that's okay.
That's fantastic. Thank you, Lieutenant Governor Green. Really great update. As you can imagine, when we asked people to submit questions, I would say 90% of them were COVID related or in that area. But I'm going to take a little bit of a diversion from that. We're going to get into it, but I did want to talk a little bit about some of the non-COVID questions and maybe to get to know you a little bit as well. So one of the questions that I had, and because I have the mic, I can ask the first question, was, there couldn't be a better time to have a medical doctor as our lieutenant governor, right? Not perfect time is probably not the right way to say it, but it's great that we have a medical professional in that position right now. And you're a successful doctor. So my question is, why did you decide to go into politics?
Thank you. It was pretty happenstance. When I came to Hawaii in 2000 to be in the National Health Corps, which was an incredible experience. And so I got placed there for public service to be the doc in KAU. And during those years where I was also working in the ER in addition to the clinic, I saw a lot of pretty tough cases, very little treatment for drug addiction and not enough trauma services. And I saw 2 one-year-old little boys suffer severe injuries. One lived and one didn't make it. But it was heartbreaking to see that. And I was just really concerned that people didn't have what they needed in the countryside. So I ran for office just to make a point that we needed these services for all of our state. And then it turned out that the guy I ran against was a cocaine dealer. And when that came out, they accidentally elected me. And ever since, I've kind of been in office. And I've been honored to do it. I married my wife, Jamie, after about a year and a half of being in office. And every cycle, we kept trying to figure out a way to not be in elected office if it wasn't necessary, but people have been very generous with me. So, I wanted to have a wider ability to communicate. And so the lieutenant governorship was a way that I could still be a doctor and be lieutenant governor. And so things just happen, I guess, for a reason, but we never expected COVID to happen also during all this. And I tell you what, I would trade my career and have not had to experience COVID for our people. But we're going to get through this fine. And I hope that people see that modest value that I've tried to apply by being a doc on call and then this job.
Right. So this group here, we're a sales and marketing association for the hospitality industry. And I think, we're always looking for the next high-tech tool and ways to communicate with our potential guests. And I don't know if you noticed, we called this Beyond the Whiteboard. You seem to have done an amazing job with your marketing and communication with a simple whiteboard and social media. So, and you've been able to do a great job. So we're trying to figure out what can we learn from you about communicating to prospective guests in the community?
Well, again, things happen in weird ways. The way that whiteboard happened was I had it in front, I was just drawing down notes and I was aggravated. So I flipped it and it flipped really cool. And then it became a thing. It was really quite bizarre, but people just really responded to something very easy to relate to and straightforward. There's no question that was a benefit. And though there's a million ways, you can go into the Department of Health's website, which is excellent, but you get lost in it almost immediately. Whereas a whiteboard, people can, they develop some muscle memory with their brains where they see where I'm even writing the number of cases, and that consistency is good. It's also to the point in general. I don't drift too much. We try to always keep it under a minute so that it can be on Instagram. And just to share a little bit of trade secret from us, no one really cared much about what I was saying before COVID. I mean, a few friends and my mom, right? And then we started doing this and we went from, I think, 2000 to, I don't know, our multiplier, we probably have 100,000 people in our social media circle now, just from the whiteboard and communicating basics, and not through hour-and-a-half long press conferences. This really worked. So simple is good. I'll even show you my notes. I don't know if you'll be able to see it with the backdrop, but every day I still write out by hand the case counts, the basics, and the numbers of our hospitalizations. And then I quickly translate the best things. It's not time consuming. I've always felt that to be a good way, because then I know other people will be able to internalize it also. And then, of course, there's always a little bit of Hawaiiana that won't hurt. You guys, that was a magnificent video up front for people to, to see. But really just being down to earth. And, I try not to look fancy or do anything different. I just make it part of the normal day. And it has really worked well for us.
So for all those listening, and I think those are great messages for marketers and salespeople out there. Keep the message simple, be consistent, short, and authentic. That's what I got from that. So that's fantastic. So before I have one more question before we start jumping into the COVID world is, you mentioned social media. When people aren't flaming you're active on it, but it's a weird world now with all the social media and people having this platform. How do you deal with the negativity, the sniping, and the sort of the outright meanness that comes out of social media sometimes?
Well, I almost never read the comment section, honestly, just because I know, just as a person and as a doc, that there's a certain percentage of people that are just not going to get there in a nice way. I have the luxury of not reading comments too much. I actually give out my cell phone number for a unique reason, which is it's very rare for people to contact you directly if they're just going to be nasty or go off. So I don't get a lot of calls. I only usually get constructive stuff. Very rarely do I get calls on my cell phone. Jamie freaks out that I give it out, but I'm happy to do it. But on social media, it's the opposite, right? It's anonymous enough that people do that. And so I just use that as a communication device, a mass communication device for the social media. It turns out I'm really sensitive. So when somebody touches a nerve, if they're being cruel, I usually will respond more than my team would like. And I'm mindful of that. I mean, for me, anticipating that if the next job occurs, that I'm going to have to really shepherd the whole state, I'm going to spend a lot of personal energy on asking people to be civil in their discourse. And to that end, I'll do my part to go overboard on accepting others with different opinions and different views. I will never demonize people if they have like super duper conservative views as compared to some liberal idea I have, or if we're flipping that, I won't judge them negatively, but in turn, the trade-off is I try to insist that everyone be kind to each other. And I think that it will work. And if people are nuts and gonzo and they still want to go off, I usually just, all right, if I was allowed to, I would, kind of totally tone that out or tune that out. But you know what? Communication is still good. And I've grown up with a lot of friends from different countries, and they just are amazed that we allow open communication at all. And it's probably a good thing from a First Amendment standpoint.
Well, the people on this call are all hospitality industry nice people, so you'll only be getting nice feedback from this group here. All right, so we're gonna
look. If you're pissed at me, you could still go off. Just go off nicely.
So I'm going to jump now a little bit more into the big stories of the day. So you announced the vaccine passport, or somebody announced the vaccine passport recently, and I think we actually had a lot of questions about, okay, I got the vaccine, now what? Can I travel? Do I have to wear a mask? What is the vaccine passport? How does it work, and how will it impact both us as residents and our visitors?
So a vaccine passport, which will be optional just in case someone doesn't believe in vaccinations, which is okay if that's a choice they make. I believe in it, but that's okay if others may not. It's going to be an app. Basically, we're in partnership right now already with Clear and Common Pass, where they'll be able to use the large vaccine registries, the VAMS program, which is the national thing that everyone in every state is uploading, and the companies that give the shots will be able to upload it so you can show that you're vaccinated. If you're vaccinated, then you will, by the virtue of my proposal, if they accept it all, which I'm sure they will over time, you'll be able to show that as your exemption for travel. And so if you've been vaccinated, you can travel to Hawaii without having to get the pre-test, without having to quarantine or anything like that. Same thing for inter-island. And it actually has an additional value, which is, let's say you want to have the Honolulu Marathon, you're marketing that. It would be good that either people have this up in their vaccination passport, or that they got a pre-test so we don't have to discriminate against anybody. Then they can have a totally safe experience, and we can have the large event, the marathon, or we can have outdoor theater again in Waikiki, or we can have luau's without any difficulty. Even if the numbers of gathering are supposed to be lower, this vaccine passport is kind of our passport or ticket key to having bigger events. And so I know it's going to catch on nationally and internationally. I just know it. And it's probably going to be relevant going forward, because there's going to be other, I hate to tell you this, other outbreaks and other concerns that will arise. So I'm kind of confident it's going to happen by May. We're working on it in a pilot fashion right now. And I particularly want it for us because I want us to have a vibrant recovery in the summer and fall. I don't want us to wait 2 years or 3 years till we get back to numbers that are sustainably good economically. So it's all going to be there, and it won't be totally smooth sailing, but it should be pretty good. Meanwhile, we'll have the card also. So I recommend, once you get vaccinated, get your card laminated so you don't wash it in your pants, because you don't want to lose that thing.
Mari, do we have any additional questions from the audience?
Yeah, this one is somewhat related, on that same topic of vaccinations. How do we get more than 50% of our returning residents to test for COVID-19 before they return to Hawaii from travel to the mainland? Do you have any suggestions?
It's difficult because it's a big nuisance and it's an expense, but it'll become a lot easier as the case counts drop, and we should probably move to just antigen testing with confirmatory PCR tests for those who are positive going forward. The Gov has not updated our protocols at all. That would be of great value because our traveler numbers and cases related to that have been very, very tiny, as you saw in that chart, but the cases from our own returning residents has been higher. How do you do it? There can be incentives. I mean, if in the aftermath of the main COVID crisis, we still are seeing, kind of hot spots and so on, there could be kind of a reinstitution of some quarantine after return. Could be just 3 days or some such thing, and everyone will hate that. So sometimes these things are necessary because we won't want another outbreak, but we're probably going to be pretty safe. We're now I'm moving past psychologically the need for pretest and moving pretty closely into immunizations as our way out.
We actually had a bunch of people ask about inter-island travel, and somebody just re-put it into the chat box as well, regarding the fact that, one, it's confusing because there are different regulations, and prohibitive because you need tests just to do inter-island travel. So there are people who need to do multi-island travel for business, and there are people who want to do it for vacation.
Yes.
What are we doing to remedy this, or any thoughts on how we'll remedy that?
Yeah, the CISA exemption system is still onerous. I never liked it one bit. I pushed back on that. That was, you get multiple tests and you get kind of a free pass, but you still had to test too much. Shouldn't have been more than once a week for sure, and really once a month probably. But soon our pilot or our initial use of the vaccine passport is going to be internal. So for our own people that get vaccinated, who are multi-island flyers and so on, no problem. Plus, I've actually begun to ask the question if we should just get rid of all of the inter-island quarantine rules for our own residents altogether, because with the positivity rate statewide of 1.19% and the positivity rate on Oahu at 1.02%, there's no reason at all to be, asking people to get a test if they're traveling to the neighbor islands. The only current circumstance that would be necessary, and it's not that big a deal, would be if someone was currently traveling from Maui back to the other islands, whether it's Oahu or others, because their rate is 4.73% of positivity. That's going to drop off in 2 to 3 weeks. And with rates this low and all comparable, there's no reason to have it. The one exception, of course, is Kauai. And if Kauai continues to be by far the lowest and wants no cases, that's a policy decision. And they, I know, would be very reluctant to have any travelers not have some testing. I just know that their public health officials on Kauai are true believers in excessive testing. So that one I can't control because I'm trying to play nice, but it's a challenge. I would hope that by April, May, our people inside the state will not have any of these requirements whatsoever for inter-island travel.
By the end of May.
By the end of May, and especially if you've been vaccinated. But all of 1C, everyone in I think this industry should be vaccinated by the end of 1C, and 1C should be done by May something. So that's a good thing. And then anyway, vaccinations are going to open up real wide because there's going to be a lot more vaccination companies that have gotten approved. So right now it's really constrained. It's a bottleneck. It's going to open up super wide the aperture on getting vaccinated in May, June, July. I mean, there'll be too much in the way of vaccine. Yes, though, and Jamie writes, until then, we got to get multiple tests, which is torture. It's just not something I believe in personally.
And that's a decision by the governor. If he wanted to, he could have a statewide policy. Is that right?
That's right. He just has to man up on that.
Okay. Mari, I see lots of activity in the chat box. What else do we have?
Yeah, well, and I was going to ask, as it relates to that, because we do fall into, or as hospitality, we do fall into that next phase. So is that real important step for all of us to make sure that we go to that website that you had shared, hawaiicovid19.com, and
yes.
Register?
It is important. The registration has basically been for for companies that are in the 1B. And I think the moment they open 1C, then we're going to ask people to submit their company requests for the 1C. I'll check on that for you, or have my team check on that, because we don't want to flood them and then they just don't get to it. Because they had 6,500 applications from businesses to have parts of their 1B firm vaccinated. So that alone was just a giant lift, right? It probably will be more efficient simply to lift them in large categories and open up. That's why we've been just emphasizing the most elderly individuals in society first, because at that point, if it becomes a free-for-all, it's not that big a deal. Honestly, the difference between a 30-year-old who's got asthma and a 38-year-old who's got nothing wrong with them, it's just not that big a difference at that point. If you've got severe health problems, okay, yes. But if you don't, it's not that big a difference. So it's really about people's desire to get vaccinated. And there is going to still be some vaccine hesitancy going forward, no doubt about it. More and more people are comfortable, but it's out there.
Kind of related to the numbers, that you shared with us, one of the questions in the chat is about military and how their numbers play into that. So are they accounted for? Because I guess the understanding is that military is also doing vaccinations separately.
They're not in the numbers, actually. So interestingly, the military, which is, over 100,000 people in Hawaii, of which somewhere between 60 and 70%, I would guess, will be vaccinated ultimately, maybe much more by the end of the year. Once people realize, hey, you're crazy not to get it, given how many benefits you're going to have to be vaccinated. That is not included. And the reason that's very important is because they're roaring through their numbers. Their vaccine supply that they got is separate from ours. And so you could run into a 33-year-old military person with no health problems. They may actually have gotten vaccinated. And it's not something that is broadcast that widely. They travel a lot more and they are in military service. So we have to ask them if they have to serve to not spread the disease. They live in barracks in some cases, so they could spread it a lot. But those dudes are going to provide an extra buffer on kind of herd immunity, basically, for us. So that's a good thing. That's why you will see our numbers consistently outperform other similar states by another 10% increment, because we have basically a safe cushion with the military guys with immunity now. And it's a good thing.
Right.
I like this question that just came in. I mean, there's always been a little bit of an anti-tourism, feeling in Hawaii, but it seems to have grown maybe a bit more with COVID. Always talk about diversification and things like that, but we're the tourism industry, and obviously we support that. And how do we, how do we bridge that gap between some of the community distaste for tourism and the need for it as our driving economy force?
Well, I'll share a secret with you. So when I put the Safe Travels program together, it wasn't just about stopping COVID with testing, which it did do. It was also about demonstrating that it wasn't the travelers that were causing the surge of COVID. And that was very necessary because we were extremely low with our case counts at one point. And you can imagine what the perception would have been if when we opened, we got big COVID surges. People would have, they would have discriminated against travelers. It would have been, in some cases, violent. So I made sure that we were able to really look and characterize who had cases and who didn't of COVID, and whether or not it made us unsafe, which it did not. That was really an important long-term strategic decision I made for us. In addition to that, yeah, the world is changing a little bit. Travel, no matter what, there will be a lingering effect from COVID. People will think, even if it's not accurate, that being on planes is a high-risk event. It's not, but there is that consideration. Or long trips. Sure, you're out and about in large groups and airports and stuff. It's a little more risky, but not very risky. These considerations will resonate with some of our older clientele, I'm sure. But the best thing we can do is just show that we don't have outbreaks in our state. And by being the state with the lowest rate, I always felt that it was going to really serve us well when we decided to ramp up tourism again. We probably should settle in at 7 or 8 million total travelers, just because it did seem to be a little bit of extra pressure that society couldn't tolerate. And the footprint on Hawaii was starting to, we were bending a little bit. I'm not an expert in this field, so I rely on your input. But it did seem a little harder. There are other considerations. We may ultimately look at some impact resources where if there's really high numbers or people having a large impact with long trips, maybe they will pay some fees. I don't know. We're not trying to do anything like that right now because we can't possibly dissuade travel right now when we need some success to bring our economy back. But that's how I looked at it. I won't be surprised if one of the jobs I have as governor, if that's what happens, is to diversify us some, but in a way that will also be consistent with travel here. Like, I think we're going to have safe haven opportunities for people. I think people will move businesses here for long stretches of time because they saw Hawaii is safe. Of course, economically, it's safe. It's safe from a military standpoint, but it's also just plain health safe. It'll take some work because we have to up our game with public education. We have to up our game with healthcare, but I'm working up some plans right now for that diversification.
So one of the things with the COVID-19, like for our hotels, we're putting in place all these standards. We have plexiglass, signs that say 6 feet apart, mask wearing, all those kind of things. What of those do you think are going to be the new normal, meaning that's it, we're going to be doing this forever? And which of those do you think will go away? What are the long-term impacts of COVID-19?
All of that will go away on November 1st or January 1st, something like that. You won't need any of that, in my opinion. Unless there's a whole nother surge of COVID from some variant that we were unable to protect ourselves from. What I will say is there probably will be travel advisories during cold and flu season, or travel advisories if there are outbreaks of COVID in different parts of the globe, which will then trigger people wearing masks again, would be my guess. Or describing the strains, and therefore your travel passport will either be good because you got a vaccine that was sufficient to protect you or not sufficient. That's what I would say, but I don't think you're going to see a lot of plexiglass or lines on the lines to separate people after November 1st. I think that'll be over.
So maybe a good business to get into is a reuse of a plexiglass then, I think, right?
Yeah, recycling.
Mari, what else do we have?
So I guess that being said, do you envision that there's going to be a new kind of tourism industry, or does it seem like, I mean, it kind of sounds like you think we're just going to go back to normal, potentially?
I'll tell you this, after this is going to sound ridiculous, but after the pandemic of Spanish flu in 1918, different era, I know. Within 2 years, they found that almost everyone had forgotten the impacts of Spanish flu. Just because there's something in the human condition which we cannot carry with these kind of crises. Like a world war happens, you have to move on. Now, if you had family members that were impacted or lost, of course, it's human nature to mourn and so on. But society has to move on from these events. So it will be quick for people to forget. It's unbelievable. And we saw that in 9/11 also. People wanted to travel again. Also, the price point on Hawaii. So it's higher than the average trip that is useless, like in the mainland or some lame little trip, right? So it's higher. Now people have missed 3 to 4 cycles of trips, and they're going to have that resource if they didn't lose their job. So I think there's going to be a lot of pent-up demand for Hawaii, a ton. Will it be totally normal? No, because, some people are going to actually capitalize on it. They're going to say, we want to be a platinum hotel, and we still maintain extra cleaning, even if it's not necessary, because we won't have COVID here. We still maintain a day in between visits, or we maintain standard of separation for individuals if we're concerned of extra risk. But it probably will not technically be necessary. So some people will find their new normal and they'll use it to their advantage. Otherwise, yeah, we'll go back basically to normal, except, people may just not want in the industry to go back to the full 10.4 million visitors a year. I mean, it was kind of hectic if I remember correctly. It might be better to do the 7-8 million, but just charge them more and have them have longer trips. So there's not as much burden for travel. I'm not sure the airlines will like that, but they're going to adjust. I mean, everyone, after experiencing the baseline of March, April, May, June, when nobody was coming here, July, everybody's going to be glad just to have anything that's survivable. So I think that's where we're going to go.
So I would venture to say that at least 50% of the people on this call have either been laid off or furloughed. What words of advice or encouragement can you give them? I'm sure some people also want to ask about the UI delays as well.
Yeah, absolutely. I would say have heart. We're going to be over 70–80% of our travel baseline in the fall. In fact, even in the summer, we're probably going to get a lot more people. So hotels will open aggressively. It's difficult to open when you're still just getting 30% occupancy because, the hotel owners still lose money. But I think they're going to really be doing that. And I think that 2 weeks after vaccination, if we use that as our standard travel here, we'll be full and we'll be safe. I am sorry about the unemployment thing. I mean, I don't micromanage that because it's just not my actual job and I'm not in that space, but we press all that we can to get them to fix that. There were a lot of people that had delays. There was a somewhat finite amount of money, but we were supported by the federal government pretty well. The next package is going to be fully approved, and that's money that will be in our pockets. And then also in Hawaii, we're going to see a boom. So people who were really short and it was just very lean times are going to have had this dip already. And then you're going to get the surplus, the monies that come from the new CARES Act, and we're going to get the boost of tourism this summer and fall. I think it's going to be a pretty rich fall for people. So I'm hopeful about that. I feel terrible that people lost jobs. Everyone lost some opportunity almost, except for the very wealthy. I understand that it just didn't really impact people that much at the top of the food chain. But that's a historic socioeconomic unfairness that exists. Regular people like us, you're always taken on the chin a little bit when there's tough times. We're going to do well in Hawaii, though. We're really going to get everyone back to work. I will be shocked if people are not employed through this summer and fall.
That's great. I'm just like Dan said, it's easy to guess that maybe 50% or more of the people on this call are unemployed. So I think that that's very optimistic and hopeful for everybody looking forward. In hospitality, obviously, we're moving in the right direction, which is great. Tier 3 today. I think I read an article last night about how potentially, if everything goes well, we could be at Tier 4 by the end of next month. Yes. One of the questions from the audience is kind of in regards to the impact on restrictions on large events. Obviously, that's a huge impact for hotels with, we're not able to do banquets. There's so many restrictions. But I guess, what are your thoughts on that? Do you think that it should be something that we should be able to get to sooner as, with the infection rate being so low?
I do. I think we should lift that on May 1st. And the reason I say May 1st is because that coincides with us finishing the 1C category of vaccinations, which means we're so much safer. So even if we ourselves are vaccinated, we won't take it home to our parents or our grandparents. So we don't have as much risk. So if you have a banquet of 125 people, most of whom are visitors, and they will have vaccinated very likely as their travel precaution or pre-tested, it's extremely low risk. But also, because our accommodations folks are going to be immune, it's fine to be a waiter or a banquet chair head or a greeter or whatever. It'll be fine. So I'm going to continue to press for that. As long as we don't have a surge, we'll go from tier 3 to tier 4. And I know Blangiardi, the mayor, who I'm fond of, we're friends, wants to go there. He and I are calculating that move together. That's why I spend all this time on these numbers. I want the numbers to reflect reality, and I want us to put out a fire before it spreads so we don't get stuck for too long. So that's important. I think if we can achieve that, like you said, it should be about the 18th of March is the soonest we could go to tier 4, and we should be able to do that if our numbers keep where they are. Then large gatherings. That's why I'm so fixated on this vaccine passport concept, because it's an additional way to empower the mayors to make that decision to have large gatherings. And we're not really talking about rock concerts. We're talking about 150 people, a wedding, right? Yeah. So, and that opens up the wedding industry. It opens up the catering industry. It opens up, the banquets. It opens up everything. And that is money. So I think that's the way.
Do you think, is it anticipated that as we move into these new tiers, so like now we're in tier 3, are you expecting that we're going to see a bump in numbers naturally up and then come down again, or?
It's hard to say. And Senator Schatz, Brian asked me that question last night. we have two competing situations now, right? We're every week we're vaccinating an extra 60,000 people or 60,000 shots. Okay. So a lot of people. So we're getting more and more immune, but we also have to open up gradually because you can't then open up just straight to tier 4. It could very well be that we see a slight drift upward, blunted by the vaccinations. What we will see, though, the reason I don't just describe the numbers and the positivity rate, which are both relevant, I also describe the number of people that are hospitalized, because as long as our hospital numbers continue to decline, which is a reflection of severe cases amongst our elderly, we're fine. It's really okay then. And so that's a big thing. And then schools are going to open too. So there's lots of different needs for society. There's economics, there's education, there's straight up health, survival. I'm doing everything I can day by day to balance those things. I think the numbers, you asked a simple question with a complicated answer, a good question. The numbers should be stable. They should not go up unless we start seeing large gatherings of people who are unvaccinated behaving recklessly. Like, as long as we don't reapproximate the July 4th events, we will not see big surges.
That's great. I think we have about 100 more questions to ask you, Dr. Green, but I think our time has run out. I do want to start with one last softball for you, at least. When the travel restrictions are lifted, where do you want to travel to?
Boy, when the travel restrictions are lifted totally, I would like to do probably a staycation back on Maui. We used to do that a lot. And before all this time on social media and whatever, I could really go hide out in Maui. And so that's probably what I'll do. That'll probably be my next staycation away. But I just will be really, really grateful when we can see jobs come back, because I have so many relatives here, mostly on Jamie's side, that worked like as a teacher and as someone who worked at one of the hotels, and they're getting pummeled. If they lost the hotel job, the temporary job, the schools, they got their job intact. So I'm really looking forward to that. But yeah, and I'm looking forward for my mom and dad to be able to come see the grandkids again, which will be nice too.
I know everybody joins me in thanking you so much. We know how busy you are, and we appreciate everything that you're doing for the state and for the industry. So thank you so much for joining us today.
Thank you for having me.
And Mari, did you just want to wrap it up?
Yeah, no, I just, Lieutenant Governor, one of the attendees had dropped in the chat how grateful we are for you and the updates that you provide for the state. And, I think everybody echoes that feeling. So definitely thank you so much for your time today. We just wanted to make sure to share with everybody as well as we're closing up that we do have our next event that we want everybody to save the date for, which is March 18th. We will be doing a presentation with Jennifer Hill of Calibri Labs about forecasting amidst the chaos. And if anybody wants to continue to stay up to date with our events, we have monthly events that are happening, and we keep all the information up to date on our social media and on our website. So thank you, everybody. Thank you so much, Lieutenant Governor. Really appreciate you.
Thanks, everyone. Thanks, everyone, for joining us today.
Bye-bye.
Bye.